ಹೇಳಿ, ಇಡೀ ನಾಡಿನಲ್ಲಿ ತಟ್ಟಂತ ಹೇಳಿ ಅಂದ್ರೆ ಡಾಕ್ಟರ್ ನಾ ಸೋಮೇಶ್ವರ್ ಅವರು. ಕನ್ನಡದಲ್ಲಿ ಕ್ವಿಸ್ ಪ್ರೋಗ್ರಾಮ್ ಇಷ್ಟು ಜನಪ್ರಿಯ ಮಾಡಿರೋದು ಡಾಕ್ಟರ್ ಸೋಮೇಶ್ವರ್ ಅವರು. ಅವರು ಸುಮಾರು 30ಕ್ಕೂ ಹೆಚ್ಚು ಪುಸ್ತಕಗಳು ಬರೆದಿದ್ದಾರೆ. 650ಕ್ಕೂ ಹೆಚ್ಚು ಲೇಖನಗಳು, ವೈದ್ಯಕೀಯ ಲೇಖನಗಳು ಬರೆದಿದ್ದಾರೆ. ಮತ್ತೆ ಸುಮಾರು 1600ಕ್ಕೂ ಹೆಚ್ಚು ಉಪನ್ಯಾಸಗಳನ್ನ ಕೊಟ್ಟಿದ್ದಾರೆ. ಇಷ್ಟು ಒಂದು ದೊಡ್ಡ ಸಿದ್ಧಿ ಸಾಧನೆ ಅವ್ರದ್ದು. ಅವರು ಹಾಗೇನೆ ಬಹಳ ಮುಖ್ಯವಾದ ಪ್ರಶಸ್ತಿಗಳಾದ ಡಾಕ್ಟರ್ PS ಶಂಕರ್ ಪ್ರಶಸ್ತಿ, ಕರ್ನಾಟಕ ಸಾಹಿತ್ಯ ಅಕಾಡೆಮಿ ಪ್ರಶಸ್ತಿ, ಡಾಕ್ಟರ್ BC ರಾಯ್ ಪ್ರಶಸ್ತಿ, ಹಾಗೂ ಮುಖ್ಯವಾಗಿ ಕರ್ನಾಟಕ ಸಾಹಿತ್ಯ, ಕನ್ನಡ ವಿಜ್ಞಾನ ಮತ್ತು ತಂತ್ರಜ್ಞಾನ ಅಕಾಡೆಮಿಯ ಅವರು ಪುಸ್ತಕ ಬರೆದಿದ್ರು, ಜ್ಞಾನೇಂದ್ರಿಯಗಳು ಮತ್ತು ಒಡಲ ವಿಸರ್ಜನಾಂಗಗಳು ಅಂತ ಕನ್ನಡದಲ್ಲಿ. ಅದಕ್ಕೆ KSDA ಪ್ರಶಸ್ತಿ ಕೂಡ ದೊರಕಿದೆ. ಎಲ್ಲಕ್ಕಿಂತ ಹೆಚ್ಚಾಗಿ ಕರ್ನಾಟಕ ರಾಜ್ಯೋತ್ಸವ ಪ್ರಶಸ್ತಿ ಅವರಿಗೆ ಡಾಕ್ಟರ್ ಸೋಮೇಶ್ವರ್ ಅವರಿಗೆ ದೊರಕಿದೆ. ಈ ಎಲ್ಲ ಒಂದು ಸಾಧನೆಗಳೊಂದಿಗೆ ಡಾಕ್ಟರ್ ಸೋಮೇಶ್ವರ್ ಅವರು ಇವತ್ತು ನಮ್ಮ ರಿಕ್ವೆಸ್ಟ್ಗೆ he has kindly agreed, consented. So we are grateful to you, sir. We would like to thank you and invite you for your talk on an overview of health sciences in India. ನಮ್ಮ ವಿದ್ಯಾರ್ಥಿಗಳು ಇಲ್ಲಿ ನೋಡ್ತಿದ್ದಾರೆ ಮತ್ತೆ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಕೂಡ ಇರ್ತಾರೆ. ಸೊ ಇಡೀ ನಮ್ಮ ದೇಶದಲ್ಲಿ ವೈದ್ಯಕೀಯ ರಂಗ ಹೇಗಿದೆ ಅದ್ರ ಬಗ್ಗೆ ಡಾಕ್ಟರ್ ಸೋಮೇಶ್ವರ್ ಅವರು ಮಾತಾಡ್ತಾರೆ. ಸೊ ಡಾಕ್ಟರ್ ಸೋಮೇಶ್ವರ್ ಅವರೇ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತ. ಮತ್ತೆ ನಿಮ್ಮ ಟಾಕ್ ನ ದಯವಿಟ್ಟು ಕೊಡ್ಬೇಕು ಅಂತ ಕೋರಿಕೆ.
Okay, thank you. Good afternoon. Thank you very much, sir, for that lucid introduction. At the outset, I would like to thank KSTA for giving me this opportunity to make this presentation on an overview of health sciences in India with specific reference to Karnataka. First of all, let's have a bird's eye view regarding ancient medical education systems in India, which were there and still they are prevailing in India. We believe that Ayurveda existed, had its roots in Indus Valley civilization, something like 3000 years BC, and it is continuing even to this day. But definitely Ayurveda flourished in 800 BC, and it is continuing even today, and it is one of the major and important medical system in India. This is the image of Sushruta, Maharshi Sushruta, which is kept in Australian Medical University. The second most important medical education that is being imparted in India is Siddha system of medicine. Again, this system had its root somewhere in Indus Valley civilization 2500 years back, and it is still continuing today. Unani, it started somewhere 1300 AD, and it is continuing in India today. Actually, Unani system is nothing but basic Greek system which Persians and Arabians adapted to their country, their culture. It's basically Greek medicine, particularly by Ibn Sina and Al-Razi, two very well known doctors of Middle Asia. They developed this particular system of Unani. It was introduced to India in 13th century by Persian and Arabian rulers in India. The next important medical system that's being practiced in India is homeopathy. Homeopathy was started by Christian Friedrich Samuel Hahnemann, a German physician. Basically, he is a qualified doctor in modern medicine, but he developed and popularized homeopathy. It was introduced to India in 18th century by British people. Western medicine has got an important and interesting history about its arrival to our country. Actually, Portuguese were the first people who brought Western medicine to India. They taught medicine and pharmacy at Goa Medical College. The degree was known as LMP. Later, same LMP was introduced in the mainland of India also. Of course, now we do not have LMP. Later, British people started popularizing Western medicine in India from 1757 onwards. This is the first medical college which they established in 1835, Madras Medical College. It is still continuing to flourish in the state of Tamil Nadu. Later, Britishers started another two important medical colleges by 1850, one in Bombay and another in Calcutta. And if you come to Karnataka, first there was Bangalore Medical School. This was established in 1929. Later, this Bangalore Medical School was shifted to Mysore and it was known as Mysore Medical College in 1930. Then Kasturba Medical College was started in Manipal around 1953. This was the first private medical college in India. Bangalore Medical College was started in 1954, and these are the three important medical colleges which are there at present in our state. The Medical Council of India was established as a statutory body under the provision of the Indian Medical Council Act 1933. It was replaced by the Indian Medical Council Act IMC 1956. Now we have National Medical Commission. It is an Indian regulatory body which regulates not only medical education in India, but also the medical fraternity. It replaced the Medical Council of India on 25th September 2020. Now let's have a health scenario, a bird's eye view of health scenario in India. The current scenario is, at present, we are having provisions to impart medical educations, dental educations, Ayurvedic educations, Unani educations, naturopathy and yogic sciences, homeopathy, pharmacy, nursing education, physiotherapy, and allied health sciences. About 25 courses. These were started comparatively recently in our country. Let's try to know the important features of all these systems which are there in our country. Coming to medical education, if somebody wants to join medical course, that is modern medicine, he should have studied PCMB at PUC level. This is the basic qualification, basic criteria if somebody wants to apply for medicine in India. Later, after completing PUC, they should take National Eligibility and Entrance Test, NEET UG. It's mandatory. To secure admission to any medical college in India, be it a private medical college or a government medical college, NEET is a mandatory exam. This one has to understand very clearly. The National Testing Agency conducts the NEET exam for all India MBBS seats every year. In India, there are no other national level entrance examinations for MBBS courses other than NEET UG. Admission to all the esteemed medical colleges in India, including AIMS, JIPMER, and other important colleges. It is basically based on whatever the student has scored in UT, NEET, UG examinations. Of course, there are donation or management-based seats which are available to rich people. The cost may vary from something like 50 lakh to 1 crore per seat for undergraduate medical seat. Of course, this is only an approximation. The actual cost, nobody knows. In India, medical education in modern system can be broadly classified into armed forces medical education and civil medical educations. Armed forces medical education, this is being imparted at Pune in the state of Maharashtra by Armed Forces Medical College, popularly known as AFMC. The college is entirely managed by Indian Armed Forces. This is one of the best medical college that's available in India, and it is placed 34th best medical college globally. The institution primarily imparts training to medical undergraduates and postgraduates, dental postgraduates, nursing cadets, and paramedical staff. Patient care forms an integral part of its training curriculum, and the attached hospitals benefits from the expertise available at AFMC. The institution is responsible for providing the entire pool of specialists and super specialists required for the armed forces. The college is also involved in conducting research in various medical subjects, as well as those aspects which would affect the morale and performance of the armed forces, both in war and in peace. This is the yearly admission numbers. MBBS, 150 students are admitted every year. MD plus MS, 101 seats, 170 seats are available. For DM, 1 seat. For MCH, 9 seats. Diploma in various medical subjects, 23 seats. And a total of 150 students at undergraduate level. Seats are reserved for 115 seats are reserved for boys and 30 seats are reserved for girls. Of course, 5 foreign students, either boy or a girl, can get into AFMC under foreign national quota. So admission is on the basis of national eligibility and entrance test, NEET UG, followed by an interview and medical examination. Hitherto, AFMC used to conduct its own entrance examination at national level. But once NEET UG was introduced, the independent medical entrance examination, which was conducted by AFMC, was stopped. Now, NEET UG grading itself is the basic criteria if somebody wants to get it into AFMC. 10 seats are reserved for ST and SC candidates. Students are not allowed to be married or to marry during the course and are liable to serve in the medical services of armed forces on successful completion of MBBS for 7 years. 7 years. Recently, this has been upgraded to 10 years. This is known as Short Service Medical Commission. If you want to serve for a limited period in armed forces, you can take up Short Service Commission. Later, you can come out of armed forces, get a job in any state government or start your own nursing home or hospital. That provision is available. If you want to spend your entire career in armed forces, then you can take up full service medical commission. Civil medical education in India, any Indian citizen above the age of 18 years with basic eligibility criteria may seek admission for medical education anywhere in India, either in government or private medical colleges. These are the minimum percentage a person should have if he wants to get into medical education. For general category, he should score somewhere between 720 to 138. For SC, ST and OBC, he should score somewhere between 137 to 108. For general category, people with some disability, they should have minimum scoring of 137 to 122. SC, ST, OBC, people who are having some physical disabilities, they should score at least 121 to 108 marks. Of course, this is only minimum qualification, but if you want to get a seat under NEET UG, you must strive very hard and get as much point marks as possible. In 2021, totally 16.14 lakh candidates took the examination. Out of them, 95 attended the examination, and this is the marks the top 4 students have obtained. Mrinal Kutteri, Tanmay Gupta, Kartika G. Nair. All these 3 students have scored 720 out of 720. You can see the kind of competition that you are having. And the 4th rank went to the student who obtained 716 marks. So you must really strive hard to get into under government quota to any medical colleges, then you should have good percentage. This is about the total medical seats and medical colleges available in our country. Total number of medical colleges offering MBBS in India is around 595. Number of MBBS seats, 88,370 seats as on 28th November 2021. Total number of government medical colleges in India, 302. And private medical colleges, 218. Among these, 47 are deemed universities, 3 are central universities, and we have 19 AIIMS which are offering MBBS in India. Deemed universities in Karnataka, Kasturba Medical College, Manipal, JSS Medical College, Mysore, Kasturba Medical College, Mangalore, KS Hegde Medical Academy, Mangalore, Jawaharlal Nehru Medical College, Belgaum, and Shri B.M. Patil Medical College, Bijapur or Vijaypur. These are the institutions which are deemed universities and are offering undergraduate seats, that is MBBS seats, and of course, postgraduate and super specialty courses also. Central universities offering MBBS course, Delhi University, Delhi. Every year, they take 600 students. Jawaharlal Nehru Medical College, Aligarh Muslim University, Aligarh, 150 students. Institute of Medical Sciences, Banaras Hindu University, Varanasi, 84 students. These are the top medical colleges which students usually seek. If they get an opportunity to join these colleges, they will be happy to take up seats in these colleges. And other central universities, Lady Harding Medical College for Women in New Delhi, Maulana Azad Medical College, New Delhi, University College of Medical Sciences at New Delhi. Totally 600 seats are available under these central universities. The top 10 medical colleges in India are All India Institute of Medical Sciences, New Delhi, Kasturba Medical College, Manipal, Chandigarh Postgraduate Institute of Medical Sciences, Christian Medical College, CMC Vellore, King George's Medical University, Lucknow, Jawaharlal Nehru Medical College, Aligarh, Chennai's Sri Ramachandra Medical College and Research Center, Jipmar, Puducherry, earlier known as Pondicherry, and Banaras Hindu University, Institute of Liver and Biliary Sciences, New Delhi. These are the top institutions in the country. So total number of MBBS seats in government medical colleges, including AIIMS, central universities and ESI colleges, are 44,555. Of course, these numbers are only an approximate number. Every year, these numbers may change. Total number of MBBS seats in private and deemed medical colleges are around 43,815. MBBS seats in deemed universities are around 8,000. Total undergraduate MBBS seats in India are divided into two categories. The first category, 15%, this belongs to All India quota. And the second category is 85%, which includes 85%. This comes under state counseling quota. These 85% of respective state counseling quota is allocated to the domicile students of a particular state upon their successful completion of the eligibility criteria. Moreover, the medical aspirants qualifying in NEET cutoff percentage will only be considered in this allotment process. That cutoff percentage will be announced on the website. NEET reservation criteria for 15% All India quota, for SC 15%, ST 7.5%, OBC 27%, general, that is economically weaker section, this is around 10%. We should have some rough idea about the various medical colleges that are present in our Karnataka. We have approximately 60 medical colleges, including both government and private medical colleges. AJ Institute of Medical Sciences, Mangalore, private medical college. Adi Chunchanagiri Institute of Medical Sciences, BG Nagara. Alameen Medical College, Vijapur. Bangalore Medical College and Research Institute, Bangalore. This is a government college and one of the best college that's there in the state. Bidar Institute of Medical Sciences, Bidar. Basaveshwara Medical College and Hospital, Chitradurga. East Point College of Medical Sciences and Research Center, Bangalore. ESIC Medical College, Gulbarga. This is also an upcoming college in Gulbarga. Again, this is a Government College, Father Muller Medical College, Mangalore, Gulbarga Institute of Medical Sciences, Gulbarga, Jawaharlal Nehru Medical College, Belgaum, JSS Medical College, Mysore, Karnataka Institute of Medical Sciences, Hubli. This is a government medical college. Kasturba Medical College, Mangalore, Kasturba Medical College, Manipal, Kempegowda Institute of Medical Sciences, Bangalore, Raja Bande Nawaz Institute of Medical Sciences, Gulbarga, Koppal Institute of Medical Sciences, Koppal, K.S. Hegde Medical Academy, Mangalore, Mysore Medical College, the first medical college that was established in India. Still, it is one of the best medical college in the state. Mahadevappa Rampure Medical College, Gulbarga, Mandya Institute of Medical Sciences, Mandya, National Institute of Mental Health and Neurosciences, Bangalore, Navodaya Medical College, Raichur, Oxford Medical College, Bangalore, Raja Rajeshwari Medical College and Hospital in Bangalore, yes, Nijilingappa Medical College and Hospital and Research Center, SS Institute of Medical Sciences, Davangere, Devaraja Aras Medical College, Kolar, Shivamogga Institute of Medical Sciences, Shivamogga, St. John's Medical College in Bangalore, Vijayanagara Institute of Medical Sciences, Vaidehi Institute of Medical Sciences and Research Center, which is present in Bangalore. These are the important medical colleges that are available in the state of Karnataka. This is the bird's eye view of MBBS course, not only in Karnataka, even at the national level. As you can see in the chart, foundation course starts in the month of August. Foundation course is very important. UGC and National Medical Commission has made it mandatory to start foundation course in all professional courses, including medicine and engineering. This usually runs for a month. After completing foundation course, first year MBBS starts from the month of September and it continues till August in the following year. Later, you have first year MBBS examinations in the month of September. Later, from the month of October, second year MBBS starts and continues till August. In September, you have phase 2 examinations. Then third year MBBS part 1 starts. These are the basic, some basic subjects you will be studying in the first part. Then you have to take up phase 3, part 2 examinations, your electives, and the skills that you want to develop. After completing these 4.5-year courses of medicine, you have to do internship of 1 year compulsorily. This is about the basic information regarding foundation course. So foundation course, it's basically for 1 month, as I have already mentioned. And in the first year, you will be studying human anatomy, human physiology, and biochemistry. An introduction into community medicine and humanities. Usually medical students, they neglect community medicine and humanities. But if you want to become a really good doctor, and useful to the society. You must give equal importance to community medicine and humanities. And you will be introduced to clinical exposure very early in the very first year itself. And you will have a special coaching on your attitude, your ethics as a doctor, and your basic skills in communication. Because communication skills are very important for a doctor. Depending upon the intellectual capacity or the educational background of the patient, whether he is from the rural setup or from the urban area, you have to judge his understanding capacity of whatever information that you are trying to provide. Then you should select such a simple language, either in English or local language, and try to explain what exactly has happened to him and what exactly you are planning to treat. This is very important. Of course, you must try to avoid as much as possible using medical jargons. Try to avoid them. Try to communicate to them in very simple and straightforward sentences. It should be very simple. And once you master the art of communication, then you can dream of becoming a good doctor. This communication skill you have to learn throughout your medical courses. After successfully completing the first year, you will be entering into second year MBBS. This is about 12 months course. You will be studying pathology, microbiology, pharmacology, forensic medicine, and toxicology. You will be introduced to clinical subjects here. You will be attending hospitals. You will be examining patients by their bedside. And you will be going to rural centers in Karnataka, around Bangalore. If you are studying in Bangalore, then you will be visiting primary health centers in and around Bangalore to have basic exposure to community medicine. Then your clinical postings, they are started in the second year itself. And again in second year, regarding the ethics and medical communication skill, will be trained again and again. That's very important. After completing second year, you will be entering into third year, third professional MBBS Part 1 course. This is a 12 months duration course known as Professional Part 1. You will be introduced to general medicine, general surgery, obstetric and gynecology, pediatrics, orthopedics, dermatology, psychiatry, otorhinolaryngology, which is known as ENT, ear, nose, and throat, ophthalmology, community medicine, forensic medicine and toxicology, respiratory medicines, radiodiagnosis and radiotherapy, and anesthesiology. These are the some new subjects they have introduced recently, like respiratory medicine, radiodiagnosis and radiotherapy, and anesthesiology. Usually, one used to have some exposure to these specialties for either a week or for two earlier, but now that's not the case. You will going to have a thorough introduction into these subjects, and you will have clinical postings where you will be examining the patient on your own independently. Of course, whenever you get doubts or you need clarification, you can approach your teaching medical doctor. Again, in the third year, first professional part also, you have to refine your medical communication skills, and you should learn basic medical ethics also. Next, third professional MBBS part 2, professional part 2. This is 13 months course. Minor subjects you are not studying in detail, but whereas major subjects which an MBBS doctor will be practicing in his life, if he prefers a family physician's role, then he should be thorough with the most common cases that one can see and treat in his daily practice, like general medicine, pediatrics, general surgery, orthopedics, OBG, including family welfare and allied specialties. They will be deeply exposed to clinical postings, and this is the best opportunity where students can refine their medical skills, particularly as far as practical knowledge is concerned. See, theory you can learn any day. Whenever you want, you can learn theory. But practical examinations, you have to learn in this year, in these 13 months. You must be very thorough. And as much as possible, you must see different cases. If possible, you can go to different unit. If some special cases are available in those different units, with the permission of the head of the department or the head of the unit, please examine that special case also and try to enrich your knowledge. So this is the toughest part one can experience in his medical course. So coming to health sciences, which are being imparted in Karnataka by Rajiv Gandhi Health University. You can see MBBS undergraduate. The duration is 4.5 years plus 1 year. That means 5.5 years, approximately 6 years. You should dedicate to complete your MBBS course. After completing MBBS course successfully, you can take either postgraduate diploma or postgraduate MD or MS courses. Postgraduate diploma is for 2 years, and postgraduate, either MD or MS, you should study continuously for 3 years. After completing postgraduate education, if you prefer, you can apply for postgraduate super specialty courses. These are available in Karnataka, and this course is of 3 years duration. PG courses in basic medicine you may do if you prefer either anatomy or physiology. If you do not want any clinical subjects and you want to do preclinical subjects like pharmacology, pathology, microbiology, forensic medicine, or preventive medicine, you can take up either diploma or forensic courses. And PG courses are also available. These are the various diploma courses that are available in different subjects like Anastasia, diploma in anesthesia, diploma in dermatology, diploma in orthopedics, diploma in ear, nose, and throat, diploma in child health, that is pediatrics, DPM, diploma in psychiatry, radio diagnosis, DMRD, obstetric and gynecology, which is known as DGO, ophthalmology, diploma in ophthalmology, radiotherapy known as DMRT, diploma in medical radiotherapy. You can do diploma even in tuberculosis and chest diseases also. You will be getting degree known as DTCD. In among postgraduate courses, general medicine MD is the most popular one. General surgery known as postgraduate degree in medical surgery, OBG, MS, pediatrics MD, tuberculosis and chest diseases MD, transfusion medicine MD, Anastasia MD, dermatology MD, ophthalmology MS, orthopedics MS, ENT MS. All these courses you can take on. Psychiatry MD, radiodiagnosis MD, radiotherapy MD, and cardiology super specialty course, cardiology DM, medical oncology DM, pediatric oncology DM. These are the super specialty courses available in Karnataka. Cardiac anesthesia also you can do. Neurology DM is also available in Karnataka, including nephrology. Critical care, very few people opt for this course because you will be under constant stress when you are working in emergency and critical care room. At least you have to handle 40 patients at any given moment, and it puts really a great stress on you, and you should have enough stamina to withstand this kind of pressure and succeed in this particular course. PG and DM courses in Karnataka, these are the courses. Master of Chirurgery, MCH means. They are available in cardiovascular and thoracic surgery, pediatric surgery, urology, head and neck surgery, gynecologic oncology, surgical oncology, neurosurgery, and plastic surgery. Coming to dental sciences, which are available in Karnataka, the graduation course, undergraduate, BDS, Bachelor degree in dental sciences or dental surgery, totally 5 years, the duration of the course is. MDS, it is of 3 years. First year BDS, you will be studying general human anatomy, including embryology and histology, general human physiology, biochemistry, nutrition and dietetics, dental anatomy, embryology and oral histology, dental materials, preclinical prosthodontics, crown and bridge. In second year BDS, you have a set of different medical subjects. In third year BDS, you will be exposed more to practical knowledge like general medicine, general surgery, oral pathology and oral microbiology, conservative dentistry and endodontics, oral and maxillofacial surgery, and other things. Fourth year BDS, these are the various subjects that you will be studying. And coming to Ayush courses, which are available and to which you can get entry through your NEET UG examinations. Ayush BAMS, Bachelor of Ayurveda, Medicine and Surgery. This is 5.5 year course. You have Bachelor of Homeopathy and Medicine System, known as BHMS. Again, this is a 5.5 year course. You have Bachelor of Unani Medicine and Surgery, known as BUMS. Again, this is a 5.5 year course. After completing your undergraduate courses in Ayush, you may seek even postgraduate courses also, which are available in Karnataka. Postgraduate in Ayurveda, known as PG Ayurveda, this is of 3 years duration. Postgraduate in Homeopathy, known as PG Homeopathy, again it's a 3-year duration course. Postgraduate in Naturopathy, postgraduate in Unani, these are all again 3-year courses. Coming to health sciences, various nursing courses that are being imparted in Karnataka. BSc Nursing Basics, known as BSc Nursing Basic. This is a 4-year duration course. Then you can do BSc nursing, post basic, 2 years course. You can do even MSc nursing course for 2 years. These are the 3 important nursing courses available in Karnataka. Coming to pharma courses, here I would like to stress a little more on Pharma D, the first one. Please see the duration of the course. It is 5+1, totally 6 years course. This was recently introduced a couple of years back. If you prefer to take Pharma D, I think you are the luckiest person. You will be completing undergraduate course, postgraduate course, including super specialty course in Pharma D. You can come out of your course with a doctorate. You will be awarded doctorate also. So you can call yourself Dr. So-and-so. This is a very, very interesting, very fulfilling, very satisfying course that's available in Karnataka and also in India. People who complete Pharma D successfully, usually they don't stay in India, because in Western countries and other countries, they have lots of scope in pursuing research courses in pharmaceutical industries. The most common pharmaceutical course, pharma course, is Bachelor in Pharmacy, known as B Pharma. This is of 4-year durations. After completing B Pharma, if you prefer, you can complete M Pharma also. This is of 2 years course. Physiotherapy courses are also available. You can opt for physiotherapy courses after your PUC and NEET UG examinations. Bachelor in Physiotherapy, known as BPT. This is a 5-year course. MPT, Master of Physiotherapy, or Postgraduate in Physiotherapy. This is of 2 years course. Usually people, they don't prefer to do Master of Physiotherapy. Rather than they try to improve their skills with their basic knowledge of Bachelor of Physiotherapy, BPT. Then we have something known as Allied Health Sciences. These were started recently. Undergraduate BSc Allied Health Sciences and postgraduate Allied Health Sciences. BSc Allied Health Sciences, this is about 4 years course. And PG Allied Health Sciences, this is 2 years course. What exactly we mean by Allied Health Sciences? Let's try to have a approximate idea. Bachelor of Sciences in Medical Laboratory Technology. This is known as BSc MLT. Medical laboratory technology is an important aspect of medical science, medical practice. Once you complete this particular course, you can have your own laboratory setup, or you can work in major laboratories or in hospitals, or you can get into the field of teaching. Bachelor of Science in Operation Theatre Technology. This is also very, very important and in demand, not only in India, even in abroad also, particularly in the Middle East countries. BSc OT Technology. After completing your PUC, directly you will be entering into these allied health sciences, and it will be easy for you. Bachelor of Sciences in Cardiac Care Technology. BS Cardiac Care Technology. You know, in India, almost all specialty hospitals, they do bypass surgery, open heart surgery and other related open heart surgeries like valve replacements and other things. And if somebody wants to do these surgeries routinely, they should have a very good support of cardiac care team. And these BSc cardiac care technology people, they form the core members of this cardiology or cardiac care team. Bachelor of Science in Perfusion Technology. Perfusion technology is also a part of cardiac care technology itself. Perfusion technology, in some cases, what happens? You may have to infuse blood, and they may temporarily shunt blood from the body to a machine, perfusion machine. Here you have to maintain the blood properly, see that machine oxygenates the blood efficiently so that doctor can perform his surgery without any tension. So this is also a course which is in very demand. Bachelor of Sciences in Neuroscience Technology, BSc Neuroscience Technology, again on another important allied science subject. Bachelor of Science in Renal Dialysis Technology. This is also an important and very much in demand subject. It's difficult to get even seats also, because once you have this particular degree, you can start your own dialysis center, or you can work in any dialysis centers or hospitals. Even you can go abroad also. Bachelor of Science in Respiratory Care Technology, BSc Respiratory Care Technology. Of course, during the COVID pandemic, these people had lots of work, and they are one of the forefront COVID warriors during the pandemic period. Bachelor of Science in Anastasia Technology, another course which is very much in demand, BSc Anastasia Technology. You will be assisting the doctor who's trained in anesthesia. So you form a core member of anesthesia team. Bachelor of Science in Imaging Technology, again another branch of allied health sciences, which is in very much demand, is imaging technology. Nowadays, it has become very common for any disease. Your doctor will ask you to undergo either CT scan or MRI, or take X-ray, or undergo ultrasound scanning of your abdomen or any other organs for that matter. And these people, these technologies, they actually help in preparing the patient. So this particular expertise is very rare in the country and very much in demand. Bachelor of Science in Radiotherapy Technology, BSc Radiotherapy Technology. These people are somewhat rare. Usually people, they do not want to go to this particular branch of allied health sciences. The simple reason being is you have to treat cancer patients, radiotherapy. And as far as my knowledge goes, people with real dedication alone will seek entry into this particular branch of health sciences. Master courses also you have in allied health sciences, clinical psychology, MSc, renal dialysis technology, MSc, medical laboratory technology, MSc, and perfusion technology, MSc. These courses are available under Rajiv Gandhi Health Universities. Of course, hospital administration is also available. This is a basic overview of health sciences that are being taught in our Karnataka specifically and in India in generally. I'll be happy to answer any questions if you have.
Sir, thank you very much. Sir, Dr. Someshwar, sir, thank you very much for a very good overview of your talk on medical technology and medical sciences. Hello. Hello, namaskara, sir. Hello. ಇವರು ಮಾತಾಡೋದು. If you have any questions, students. Hello. Sir, Eknath sir.
Show menu ಬರುತ್ತಾ ಟಾಪ್ ಲೆಫ್ಟ್ ಅಲ್ಲಿ on your screen.
Cisco Webex events ಇದೆ, event info hide menu bar ಅಂತಿದೆ.
ಶೇರ್ ವ್ಯೂ ಅಂತ ಇದೆ ನೋಡಿ ಸರ್, ಅದರ ಜಸ್ಟ್ ಕೆಳಗಡೆ
Show me menu bar.
ಶೋ ಮೀ ಮೆನು ಬಂದು ಅಲ್ಲಿ ಆಡಿಯೋ ಅಂಡ್ ವಿಡಿಯೋ
Audio video ನಾ?
ಆಡಿಯೋ ಅಂಡ್ ವಿಡಿಯೋ
ಇಲ್ಲ ಸರ್, ಆಡಿಯೋ ವಿಡಿಯೋ ಯಾವುದೂ ಇಲ್ಲ.
ಇದೆಯಾ?
ಇಲ್ಲ
ಎಡಿಟ್ ಶೇರ್ ಅಂತ ಇಲ್ವಾ?
ಇಲ್ಲ ಸರ್.
ಓಕೆ ಓಕೆ ಸರ್, ಕೆಲಸ ಮಾಡ್ತೀನಿ. ಮೊಬೈಲ್ ಆನ್ ಮಾಡಿ ಇಟ್ಟು
ಹಾ, ಮೊಬೈಲ್ ಆನ್ ಮಾಡಿ ಇಟ್ಟಿರ್ತೀನಿ.
Sir, thank you very much for providing us a
ರಮೇಶ್
overview.
ಸರ್, ರಮೇಶ್ ಸರ್, ರಮೇಶ್
ಹಾ.
ಸರ್, ಅವರು ಮೊಬೈಲ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ. ನಿಮ್ ವಾಯ್ಸ್ ಮೊಬೈಲ್ ಅಲ್ಲಿ ಕೇಳುತ್ತೆ, ಅವ್ರಿಗೆ ಮಾತಾಡಿ.
Sir, thank you very much for your wonderful overview of medical education in India and how students could apply and get benefited. Rather, if they are interested, they can pursue medical education. ಅದ್ರ ಬಗ್ಗೆ ಬಹಳ ಚೆನ್ನಾಗಿ ವಿವರಣೆ ಕೊಟ್ಟಿದ್ದೀರಿ ಸರ್. ಸರ್, ಒಂದು ಕ್ವೆಶ್ಚನ್. Is there a PG course in geriatric medicine in India? Hello, sir.
ಸರ್ ಅವ್ರು ಆನ್ಸರ್ ಮಾಡ್ತಾರೆ, ಒಂದೇ ನಿಮಿಷ ಇರಿ ಸರ್. ಹಲೋ
ಹೇಳಿ ಸರ್.
Sir, is there
Ah.
is there PG course in geriatric medicine in India?
ಹೇಳಿ, ಕ್ವಶನ್ ಹೇಳಿ.
ಆಂಟೋನಿ ಓದ್ಬಿಡಪ್ಪ, ಅದನ್ನ ಅಲ್ಲಿ ಬರ್ತಿದ್ದೀನಿ ಚಾಟ್ ಅಲ್ಲಿ.
No, in Karnataka we do not have geriatric medicine. ಇಲ್ಲ. India we have. College offhand I cannot tell.
ಸರ್ ಆನ್ಸರ್ ಮಾಡಿದ್ದಾರೆ ಕ್ವಶನ್ಗೆ. ಇನ್ ಕರ್ನಾಟಕ ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ಕಾಲೇಜಸ್, ಬಟ್ ಇನ್ ಇಂಡಿಯಾ ವಿ ಹ್ಯಾವ್ ದ ಕಾಲೇಜ್.
We have courses, sir, geriatric medicine.
ಓಕೆ.
ಇನ್ನೊಂದು ಆಂಟೋನಿ.
This particular course, this particular subject has to pick up in India, but actually, as you know very well that majority of the Indians are around the age of 27 years. Our senior citizen population is around only 10%. That's the reason this particular course has not picked up very well. Of course, in coming days, probably people may take more interest in geriatrics also.
ಓಕೆ ಸರ್, ಸೆಕೆಂಡ್ ಕ್ವಶನ್.
Ah.
Is there any course related to palliative care?
palliative care.
Yes.
Palliative care, if you become a nurse in cancer treatment, then you will be exposed to palliative care. Because say once you become a nurse, you can get your own specialization in that. Either you can become a psychiatric nurse or a surgical nurse or a renal dialysis nurse, like that cancer nurse also. Those cancer nurses will have exposure to palliative care. Hey. Family medicine courses in India.
Yes, sir.
Is there a PG course in family medicines in India? Of course, it is available under Rajiv Gandhi Health Universities. If you want to have family medicine, certainly you can do it. And Indian Medical Association is also offering certain diplomas in palliative medical care and also in family medicines.
And how is the biotechnology courses, sir?
Biotechnology, certainly they don't come under medical sciences. Biotechnology only where certain medical instruments, that has got a good scope. Usually that comes under engineering faculty, not under medical faculty. It is an engineering course.
Okay, fine, sir. Ramesh, sir, he has answered all the questions.
Sir, thank you very much for your very good overview of medical education in India. I'm sure students will be highly benefited by your talk. This video will be uploaded on our website, sir. Students will also view on our YouTube channel, and particularly in Cisco WebEx, not many students have joined. However, many students have joined on YouTube direct some delay. They will be benefited by this talk, sir. On behalf of KSTA and all the participants, thank you very much for this excellent talk, and we'll be looking forward to many more talks by you in future. And I request you to kindly consider earlier I had requested you for a quiz on 26th. I will be writing an email today, sir. For 26th of February, we will be planning a quiz by you, sir.
Okay.
26th January should be fine for me.
Okay. February, sir.
I'll be happy to join. I will
Yes, sir,
talk
it's
to you, sir.
February. It's February, sir.
I will talk to you.
Yeah, fine. Yeah.
Okay.
Thank you very much, sir.
Thank you. Thank you very much, sir.